Today's the last day to sign up for health insurance coverage that would begin January 1st through Healthcare.gov. It's also the last day you can change an existing plan if you want coverage on January 1. The penalty is going up for Americans without insurance in 2016 to $695 or 2.5% of your income, whichever is higher. So this morning, News 2's Octavia Mitchell spoke with Sylvia Burwell, Secretary of Health and Human Services, to get some last-minute advice on making sure you get the right plan.
Secretary of Health and Human Services Sylvia Burnwell, thank you so much for joining us this morning. And Secretary Burnwell, with the Healthcare.gov enrollment deadline today, where can people sign up for coverage?
Well, folks can do it a number of ways, but if they want to go in person, they can go to the Palmetto Project Office on Rivers Avenue between 9 a.m. and midnight tonight. If they want to, they can go to our website, which is Healthcare.gov, and they can do it that way. Or if they'd like to, they can call our 1-800-318-2596 phone number and do it that way. So many options to get in-person assistance for folks to enroll today.
Are there any other important deadlines you would like to get the word out about?
So today, December the 15th is a very important deadline so that you can receive your coverage by January 1st. If you do miss this deadline, however, you can enroll up until January 31st, but we encourage everyone to get that coverage for January 1st. And the other thing, a couple other things that are important for folks to know is the importance of financial assistance and that the coverage is affordable. Right now in the marketplace, 7 out of 10 folks in the marketplace can find coverage for $75 or less in premiums a month with that assistance. We've made the website easier and simpler based on consumer feedback. And finally, as we mentioned at the beginning, in-person assistance is available if you have questions and want some help making decisions.
Secretary Burnwell, for people at home who need to sign up today, what last-minute tips do you have for them?
I would have them come in earlier in the day rather than later in the day. I would actually encourage them to go to window shopping first, which is a feature where you can go on and look at some of the plans and get a sense of what kinds of plans there are and what might be good for you. That and making sure that you have information like your income and your Social Security number ready.
What about financial assistance? Is financial assistance available to help pay for monthly premiums? Absolutely
it is. And in the state of South Carolina last year, folks received on average $280 a month in financial assistance, and that was 89% of the folks that were in the marketplace. So it's available, and it is what helps make the plans affordable. There's premium assistance, which comes in the form of the tax credit, that $280 that I mentioned a month. But there's also help for some folks in terms of out-of-pocket costs. So help with either your deductible or your copays.
Now, are plans available for both individual and family coverage?
Absolutely. You can come in and find coverage for both. And when you come in and enter your family or your own personal information, it will help you understand your financial assistance for your family or for you as an individual.
A lot of information there. Where can people go for additional information?
They can go to the website, that's Healthcare.gov. They can go to in-person assistance, and there are a number of places in Charleston. Palmetto Project Office on Rivers Avenue from 9 to midnight tonight is one place, but there are others. And if you want to find those other places, go to localhelp.healthcare.gov. Enter in your zip code and you'll find the nearest place to find that in-person assistance. There's also in-person assistance by phone.
All right, Secretary Burnwell, we certainly thank you for your time this morning.
Thank you so much for having me.